Roles and Responsibilities of Community and Public Health, presented by Melissa Murray for HCA 415, Community and Public Health, with Professor Martha Jennings, recorded 7 December 2014. The importance of public and community health. Oftentimes, when we think of healthcare, we think only of the clinical setting of doctors and other healthcare providers seeing an individual patient to heal their injury or cure their illness. Community and public health significantly impacts the health of the population at large by providing its own unique set of standards and organization. But what is public health? Public health is defined by the Institute of Medicine as what we as a society do collectively to assure the conditions in which people can be healthy. Public health is concerned with protecting the health of the entire population. Populations can range in size from small local neighborhoods to as large as entire regions of the United States. Professionals in the public health sector focus on prevention and education, administering services, conducting research, and recommending policies that will protect the health of the public. This differs from clinical professionals who treat individuals after they have become injured or fallen ill. The other portion of public and community health is community health. But what is that? Community health is defined as the health status of a defined group of people and conditions to promote, protect, and preserve their health. Community health promotes various programs and activities that will keep in mind the race, religion, and ethnicity of the community, which can all largely impact a community's overall health. The United States Department of Health and Human Services is one of the primary federal organizations that supports community and public health. The USDHHS is comprised of 14 different offices that fall under the direction of the Office of the Secretary, and 11 operating divisions which report directly to the Secretary of Health and Human Services. In the organization chart for the USDHHS, many of the well-known components of public health are seen. The operating division includes the Centers for Disease Control and Prevention. The CDC states that their mission is to work 24/7 to protect America from health, safety, and security threats, both foreign and in the United States. The CDC conducts research on various health issues, tracks diseases to learn more about them, and helps to bring new knowledge to individual health. The CDC is also best known for their response to health threats as they emerge, as seen recently with the Ebola outbreak. The National Institutes of Health is another well-known organization that plays a key role. The NIH has 27 separate institutes and several other programs which support the public health community by conducting and supporting research on the causes and prevention of disease in humans, studying the effects of environmental contaminants, and disseminating information about health and medicine. Aside from the USDHHS, there are other key public health organizations, both internationally and within the United States. The United States Environmental Protection Agency has a mission to protect health and the environment. By enforcing and implementing environmental regulations, they are able to help impact the health of the public. The Institute of Medicine, while not affiliated with the federal government directly, advises members of the government and healthcare workers about crucial health issues. The World Health Organization is the leader in public health worldwide. The WHO is responsible for providing leadership on global health matters, shaping the health research agenda, setting norms and standards, articulating evidence-based policies, providing technical support to countries, and monitoring and assessing health trends. There are legal concerns that face public health. One of the key legal issues facing public health is preemption. Preemption occurs when, by legislative or regulatory action, a higher level of government, either state or federal, eliminates or reduces the authority of a lower level over a given issue. Preemption causes many local and small movements in community and public health to be impacted negatively. However, there are studies showing positive impacts on the local and legal infrastructure of community health. A 2012 study conducted by the American Journal of Public Health examined the impact that a local legal infrastructure had on a community's health. The study, which was conducted by Dr. Julia Kostic and Dr. Dana Patton, found that the public health legal infrastructure, particularly reformed county government, had a significant effect on population health status as a mediator of social determinants of health. Reformed local government has been shown to diminish the association between poverty and poor health status among the population. With no patient-provider relationships, the main responsibility of public health is the health of the community. This poses a set of ethical dilemmas that needs to be addressed. Moving away from the ethics of clinical medicine, public health began to borrow heavily from the ethical tools developed for research ethics and bioethics. This has caused several different frameworks of public health ethics to be developed over the years. While the ethical framework of public health is attempting to steer away from bioethics, the growth of bioethics has begun to incorporate many of the principles of public health ethics into their design. Bioethics has begun to recognize the health needs of the population, the merit of pluralistic values such as equity, reciprocity, and the common good, and evidence-based decision-making. Public health programs are funded through allocations from taxes gathered at the local, state, and federal levels. When these funds are not enough to fund the programs, various contracts and grants are available through the United States Department of Health and Human Services. Contracts can be entered into by small businesses who provide services necessary to meet different program goals and objectives, as outlined by the Department of Health and Human Services. Grants are typically provided directly to state, territory, tribes, and educational and community organizations for further distribution. For chronic diseases, public and community health programs can turn to community transformation grants for additional funding. This grant program was funded under the Prevention and Public Health Fund in order to address the leading causes of chronic disease to improve the health of Americans. Health communication is imperative in public health as it impacts every aspect of health and well-being, including disease prevention, quality of life, and health promotion. When considering communication methods, take into consideration the way in which the intervention message is put out to the public, the target audience of the message, how the target audience will respond to the message, and what portions of the message will have the largest impact on the target audience.